What if I told you there's a pill that can double your testosterone without injections, without shutting down your fertility, and without shrinking your testicles? If you're a man over 40 dealing with andropause, low energy, no drive, brain fog, struggling at the gym when you used to crush it, you've probably heard about testosterone replacement therapy. Maybe your doctor even brought it up. But here's what most people won't tell you. TRT shuts down your body's own testosterone production. It can shrink your testicles. It can make you infertile. And in some cases, especially with long-term use, that may not fully reverse. And once you start, you're typically on it for life. Now, TRT absolutely has its place, and it can be life-changing for the right person. I actually broke down the full benefits and risks of testosterone replacement therapy in another video. I'll link that in the description and in the card so you can watch it after this one. But here's another option for low testosterone that almost nobody talks about. It's called Clomiphene citrate, also known as Clomid. And instead of replacing your testosterone from the outside, it convinces your brain into making more of it naturally. I prescribe Clomiphene for many men in my own practice at Bespoke Concierge MD, and the results speak for themselves. I'm Dr. Zaid Fadul, and in this video, I'm breaking down everything you need to know about Clomiphene for men with low testosterone, how it works, who it's for, the real side effects, dosing, and whether Clomid is actually as good as TRT. I'm also going to cover a newer version of this drug called Enclomiphene that has changed how I prescribe, so make sure you stick around for that. Okay, let's dive in. Here's a simple version of how this works. Your brain has a built-in thermostat for hormones. When estrogen levels are high enough, your brain says, we're good, stop making testosterone. Clomiphene blocks those estrogen signals at the brain level. So your brain thinks estrogen is low and ramps up production of two key hormones, LH and FSH, which tell your testicles to produce more testosterone. The critical difference from testosterone replacement therapy, your body is making its own testosterone. It's not coming from a needle or a gel. Your testicles stay active. Your sperm production stays intact. That changes everything. And here's why. This is the single biggest reason men choose Clomiphene over TRT. And it's not even close. TRT floods your body from outside with testosterone. Your brain sees that and shuts down LH and FSH production. Without those signals, your testicles go quiet. Sperm production tanks. The American Urological Association explicitly says, do not prescribe exogenous testosterone to men who want children now or in the future. Clomid does the exact opposite. By boosting LH and FSH, it preserves and can even improve your sperm count while raising testosterone. If you're a man who wants kids someday, or you just want to keep that door open, Clomiphene is the clear choice. You're not lazy and you're not broken. Your hormones might just be working against you. And there's a smarter way to fix that. But does Clomid actually raise testosterone enough to matter? Yes, and the data is strong. Let's look at the numbers. In healthy men, Clomiphene 50 milligrams daily raised testosterone by 146% in just 30 days. In men with clinically low testosterone, levels went from about 247 to 528 nanograms per deciliter in as early as 2 weeks. And in a randomized controlled trial with obese men, testosterone nearly doubled on just 25 milligrams daily over 3 months. Long-term results are just as encouraging. After more than 3 years of Clomiphene treatment, 88% of men maintained normal testosterone levels, and 77% reported their symptoms had improved. Now, will Clomid push your testosterone as high as TRT injections? Probably not. Injections can get you well above 1,000 nanograms per deciliter. But here's what's fascinating. When researchers directly compared patient satisfaction between testosterone replacement and Clomiphene, there was no significant difference in overall symptom improvement. Men on both treatments felt better in similar ways. So the levels are lower on paper, but the real-world results are closer than you'd think. Of course, no drug is perfect, so let's talk about what can go wrong. The good news is that the side effects of Clomiphene in men are generally mild and uncommon. In long-term studies, the most frequently reported were mood changes in about 5% of men, blurred vision in about 3%, and breast tenderness in about 2%. Let me be real with you. Here's one thing you need to take seriously. In rare cases, visual changes can persist even after stopping the medication. If you notice anything off with your eyesight, blurriness, floaters, flashes, stop the drug and see your doctor immediately. That's non-negotiable. Now, here's a critical safety advantage of Clomiphene over TRT. Testosterone replaces causes polycythemia. That's dangerously high red blood cells. Think of oil that gets too thick in the engine. This occurs in about 11% of men. It requires regular blood draws and monitoring. With Clomiphene, that rate drops to under 2%. Studies also show no significant changes in PSA or hematocrit levels during Clomid treatment, which means fewer labs and fewer worries about blood clots or prostate issues. But there's one side effect that deserves its own discussion. And what I'm about to tell you is the reason I've changed how I prescribe this in my own practice. This is real, and your doctor needs to monitor it. Because Clomiphene increases testosterone production, more of that testosterone gets converted into estradiol, a form of estrogen, through an enzyme called aromatase. About 14% of men on Clomiphene will need an aromatase inhibitor added to their regimen to keep estrogen levels in check. High estrogen in men can cause breast tenderness, mood swings, and paradoxically, low libido, even though your testosterone is higher. If you're feeling worse on Clomid despite good testosterone numbers, elevated estrogen is probably the reason. This is something we monitor closely at Bespoke Concierge MD. Estradiol is part of every follow-up panel we run because without tracking it, you're flying blind. This estrogen issue is actually one of the biggest reasons some providers are now switching to something called Enclomiphene. I'll get to that in just a minute because if estrogen is a concern for you, Enclomiphene could be the better option. First, let's cover the practical stuff you need to know before starting Clomiphene. Is Clomiphene FDA-approved for men? Straight answer, Clomiphene is not FDA-approved for men. It's approved only for ovulatory dysfunction in women. Its use in men is entirely off-label. Before that scares you, off-label prescribing is extremely common in medicine. Many well-established treatments started out that way. Clomiphene for men has been used for over 30 years with strong safety data in peer-reviewed journals. For dosing, most doctors start with 25 milligrams every other day or 25 milligrams daily. The standard Clomiphene dose in most clinical studies is 25 to 50 milligrams daily. Going above 50 milligrams hasn't been shown to work better and may increase side effects. Your doctor should check testosterone, estradiol, LH, and FSH at 4 to 6 weeks and adjust from there. As for how long Clomiphene takes to work, you won't feel different overnight. Lab changes show up within 4 to 6 weeks. Real symptom relief, better energy, mood, and libido usually takes 2 to 3 months. If fertility improvement is your goal, give it at least 3 months to reflect the full sperm production cycle. And yes, you can use Clomiphene long-term. Men treated for over 3 years maintain normal testosterone with only an 8% side effect rate. No concerning changes in PSA, hemoglobin, or hematocrit were found. But if you stop taking it, your levels drop back to baseline, just like TRT. This is ongoing treatment, not a cure. Now, here's a part a lot of you have been waiting for. Clomiphene is actually a mix of 2 molecules, Enclomiphene and Clomiphene. Enclomiphene is the active part that boosts testosterone. Clomiphene hangs around much longer, about a month, and is responsible for most of the estrogenic side effects like mood changes and low drive. Based on available data, Enclomiphene by itself raises testosterone just as effectively as mixed Clomiphene. But here's the game changer. Men who switched from Clomiphene to Enclomiphene reported significantly fewer problems with low libido, low energy, and mood disturbances. That's why it's shifted my approach. The downside? Enclomiphene is not FDA approved either. It's mainly available through compounding pharmacies, so cost and access can be issues. And large head-to-head trials against mixed Clomiphene are still needed before we can call it definitively superior. But for the right patient, Enclomiphene is a meaningful upgrade, and it's one of the testosterone replacement alternatives we offer at Bespoke Concierge MD. Clomiphene isn't for everyone, and this matters because taking it when it won't work wastes your time and delays real treatment. It won't work if your testicles are damaged. That's called primary hypogonadism. The drug relies on your testes being able to respond when stimulated, and if they can't, no amount of Clomiphene will help. It also won't help much if your LH is already elevated. That means your brain is already telling your testicles to work at full capacity and they just can't keep up. Clomiphene has nothing more to add in that scenario. Men with liver disease should avoid it since Clomiphene is processed through the liver. And if you need rapid testosterone correction, say your levels are critically low with severe symptoms, TRT will get you there faster and more reliably. The ideal candidate for Clomiphene? A man with secondary hypogonadism, meaning the problem is at the brain level, not the testes, with low to normal LH, normal testicular volume, and a desire to preserve fertility or avoid injections. And if you're not sure whether what you're experiencing is actually andropause or something else, I made a full video breaking down male menopause, what it is, the symptoms, and how to know if it's really happening to you. I'll link that one too. Here's the bottom line. Clomiphene is a legitimate, evidence-based alternative to testosterone replacement therapy for the right patient. It raises testosterone, preserves fertility, avoids injections, and carries a safer side effect profile, especially when it comes to blood count issues. The key is working with a doctor who understands the nuance, the right labs, the right dose, and the right monitoring. That's exactly what we do at Bespoke Concierge MD. We specialize in personalized hormone optimization and longevity medicine. not cookie-cutter TRT protocols. Whether you're exploring Clomiphene, Enclomiphene, or need a comprehensive hormone workup, we build a plan that fits your goals, your blood work, and your life. Click the link in the description to schedule a consultation. And if you want to get a head start or you don't know where to begin, check out the Men's Health Assessment. I'll drop that link below as well. It's a great first step to understanding where your metabolic health is and where your hormones actually stand. Before you go, I'm curious, have any of you tried Clomiphene or been offered it by your doctor? Drop your experience in the comments. I read every single one. If you have questions about testosterone treatment, the video on the right describes TRT risks and benefits. The playlist on the left covers men's hormone health and related issues in detail. I publish evidence-based medical content every week that could change your life. See you in the next video.